Our next topic is healthcare. A recent study found about half of U.S. adults say it's difficult to afford healthcare costs, with 40% having debt due to medical or dental bills. How would you make it, or what would you do rather, to make healthcare more affordable? Mr. Baumgartner, you'll go first. You have 1:30.
Well, it's a huge issue for the American economy. It's a huge issue for every family. We all spend a lot on health care. It's a tremendously big part of our national economy. And a lot of us, like including myself, we have parents that are in their golden years that are consuming a lot of health care services. So we talked a little bit earlier in our discussion tonight about what I've done to support increasing the amount of doctors, particularly in rural areas, because rural health is so important. And when it comes to the cost side, one of the crazy things about health care is that nobody knows what they're paying when they go in to consume the service. There's not price transparency. And what Obamacare attempted to do was look at, there were kind of two challenges. One was access and the other was cost. And Obamacare sought to deal with the access issue before the cost issue. And so instead of fixing that cost issue first, we have a bigger system that continues to, that's a somewhat broken system. So we'll support price transparency. The low-hanging fruit in healthcare is wellness. If you're doing things to take care of yourself, you should pay less in healthcare costs and not subsidize people that are making unhealthy decisions. So wellness is where we could really save a lot of costs. And then price transparency, so that the next time you go into your doctor and you're deciding how much you're going to spend, you know what it costs, and then maybe have systems set up like health savings accounts so you can actually roll into a retirement account or into your pocket a smarter, better healthcare decision. So it is extremely important, and it's going to become even more important as Americans' population continues to get older.
Thank you. Ms. Conroy, you have 1:30.
Thank you. Well, I'd certainly like to see the Affordable Care Act expanded so that anybody who doesn't have a job or a job that pays enough money for them to get employer-provided health care be able to get access to a good healthcare insurance that covers pre-existing conditions and make sure that people who have chronic conditions like diabetes have access to the coverage that they need. We can also make sure that labor unions have full support and workers have the right to organize for better conditions, including access to employer-funded health care. Another thing that we could do, we have the Reserve Officer Training Program for people who are willing to pledge to go into the military and serve our country for 6 years in uniform as military officers. We should also have a civilian doctor training program so that doctors, instead of having to go hundreds of thousands of dollars into debt in order to acquire medical education, let's pay for that education right up front and let them sign up to serve for 6 years in a rural healthcare system or in a lower income healthcare district so that we can bump up the number of people who can afford to be general practitioners and serve the needs of the general population where those needs are most deeply felt. And that would include all across rural eastern Washington.
Thank you. A quick follow-up regarding the Affordable Care Act. Mr. Baumgartner, this goes to you first. You'll have 15 seconds. Would you vote to repeal the Affordable Care Act if that's brought up in Congress?
No, I wouldn't, and I don't think it's a realistic policy right now. We have to work within the parameters of the Affordable Care Act to improve the system.
Ms. Conroy, the same question to you.
Mark, I would definitely not repeal the Affordable Care Act. I think that it's important. The Republicans, especially the MAGA movement in Congress, have tried repeatedly to repeal the Affordable Care Act with barely a concept of a plan to replace it. That's got to stop.
Thank you.